ba? Somebody, please call 911.
Aren't you a nurse?
Hala, hindi po. Student nurse lang po ako.
Uy, ma'am!
Ma'am!
What if we tell you that biochemistry is not just about molecules and reactions, but about understanding what the body is silently saying?
Biochemistry is a study of chemical processes in the body that helps cells and organs to properly function. It enables nurses to connect body changes with lab results and treatments, supporting accurate assessments, timely care, and better patient outcomes.
With this knowledge, nurses can detect issue early and can manage both acute and chronic illnesses quickly and accurately.
But how?
Firstly, in safe medication management, in which nurses uses their knowledge of how the body processes drugs to be able to give medicine properly, adjust doses, and monitor for side effects.
Also, it ensures accurate interpretations of lab reports. Biochemistry helps nurses understand lab value, track disease progressions, and guide care.
Example, fluid and electrolyte management, wherein knowledge of IV fluid and body fluid balance help nurses detect shifts, prevent complications, and manage hydration safely.
Another example is diabetes management for both acute and chronic. Understanding glucose and insulin lets nurses control blood sugar, prevent hypoglycemia, and time insulin to meet metabolic needs. It also helps with electrolyte balance, both acute and chronic. Nurses can monitor sodium, potassium, and calcium, and other electrolytes to prevent dangerous imbalance and complications like arrhythmias or muscle weaknesses.
How about monitoring patient conditions through blood gases, renal function, and blood glucose tests?
Guys, these lab results are confusing me. Parang mga numbers lang to sa akin.
Yung mga numbers kasi sa biochemistry ay nag-help sa atin para ma-understand natin yung kondisyon ng pasyente. For example, ABGs tells us if yung lungs natin ay nag-give ng enough oxygen and if nagre-remove ng carbon dioxide. Low oxygen can mean breathing problems like COPD.
So, pwede tayo kumilos bago lumala?
Exactly. Now, look at the renal test. High creatinine means the kidneys aren't filtering waste well. So, we adjust fluids or medications.
What about the blood sugar?
Yung blood glucose level kasi, nagsishow if yung sugar mo is too high or too low. Ito ay nag-help us manage yung insulin, prevent dizziness, and avoid long-term problems.
Ah, so biochemistry turns test results into real patient care.
Oo! Ito yung nag-help sa mga nurse mag-monitor, decide, and protect ng patient every step of the way.
This discussion leads us to research-based evidence that supports the importance of biochemistry in clinical practice. A study by Fulton et al. Explains that learners often find biochemistry difficult to apply in real patient care settings. However, the study shows that actual clinical encounters help to bridge this gap by allowing learners to connect biochemical concepts with diagnostic tests with patient conditions.
By linking biochemistry and lab results such as blood gases, renal function, and blood glucose level, nurses gain a better clinical understanding and confidence in monitoring their patients. The findings also highlights the value of clinical environments and proper supervision in strengthening their connectivity and reinforcing the nurse's role in teamwork, bedside monitoring, and safe patient care.
Why do we need to understand how antibiotics work in the body?
Yung biochemistry kasi ay yung nag-e-explain kung paano nag-a-act yung medicines sa body natin at kung anong organs yung nagpa-process sa kanila.
For antibiotics, we monitor liver and kidney tests because these organs break down and remove the drug. So, that's why we watch for side effects?
Oo, yung allergies kasi, diarrheas, tapos yung toxicity can happen if yung mga drugs isn't well handled by the body.
Sabi ni nurse, don't take my antibiotic with milk eh.
Oh!
That's because some antibiotics bind with calcium which stops proper absorption.
And this helps us teach patients better?
Exactly. When we understand the science, we give clear instructions and help patients follow treatment safely.
This kit demonstrates how understanding biochemistry enhances nursing care, especially when administering medication like antibiotics. It shows that nurses use knowledge of drug mechanism and interactions to monitor liver and kidney function, prevent side effects, and adjust care for patients with organ issues. It also highlights how biochemical understanding helps nurses give clear instructions, prevent harmful drug interactions, and educate patients effectively, ultimately improving treatment adherence, safety, and overall patient outcomes.
From assessing blood gases, renal functions, and blood glucose levels to understanding drug mechanisms, biochemistry transforms nursing care from routine tasks to informed proactive decision making. Biochemistry doesn't just explain the body, it empowers nurses to see, act, and save lives with precision and confidence.
Oh, okay ka na, ma'am?